Now, for configuration, we have to enter the testing and management site because other parts of the system depend on entering the site. We also enter the ethnicities because when we get to the part where we collect personal information of the clients, you select the ethnicity and the drop-down menu is populated from the list of ethnicities that you created here. The health district also will be populated by the list of health districts that was created in the system configuration. Also the parishes and the pharmacies. Once you get to the forms and you can't find any site, any health district, any parish, any pharmacy, any ethnicity on the drop-down menu, it means that the system has not been configured or the particular field was not added to the configuration. We are going to see the effect of not configuring this when we start creating users and accounts. Also, we enter the drug and treatment regimen so that the system or the care management forms will be populated by what is already entered, and the clinical care team will not need to type in medications. They just select what it is that they are placing the clients on. You also configure or create the names of the screenings. So I have already collected an exhaustive list of screenings from the lab and entered here. So you can choose to download this. So when you configure your in-country screenings, you have an exhaustive list of all possible screenings that are done in countries. You also configure your test modalities. You can copy this, you can come up with your own names in country, and just make sure that you know the name of the modality and what it means. So if the modality is for confirmatory test, when it's time to submit your report, you want to know what the international naming is and match them. So when you get the positivity rates by confirmatory test, you can submit this report to HCS recent and copy all of the figures from confirmatory test reports. And so we're going to see the effect of this also when we screen next week and when we go to the surveillance part of the system. Also, you configure or you create the vaccine schedule for the country. So this vaccination schedule for the country is for all vaccines, regardless of the age group or the positivity of clients. So on the national level, so you want to get the vaccination schedule from maybe the immunization manager in country and enter this. And then you want to also follow the guideline for HIV vaccination and also enter that, so that when it is time to record vaccinations, you have the list and you know the age range in which this vaccination should happen. And then for reporting, it can tell you those people who took it later, earlier, or not at all. Then we also have the census population, and this is a surveillance dependent variable. I've entered census population from 1980 to 2012, and I use the census population data of St. Vincent. So St. Vincent can choose to download this and upload to their live site later on, or just enter them from scratch again. We also have census population by census division. Also, St. Vincent census was calculated based on census division. And if you have that record in your country, you can enter it. If not, this is optional. The most important census record to collect is the census population by sex and age group. by census division might be very important for St. Kitts and Nevis, where you have St. Kitts census and Nevis census. So this is, I entered all of the figures from St. Vincent's own national data. You can also export this and use it for your life if you want for St. Vincent. Then we have the economic variables. I also use that of St. Vincent here. From 2000 to 2018, we got the GDP, the government expenditure, the educational expenditure, and the health expenditure. This is optional for countries. If you have it, you can enter it. If you don't have it, you can leave it. This is for advanced reporting if the surveillance officer wants to do correlations or some inferential statistics about what is going on in the country. But it is not required for any of the reporting indicators that you all have now. Then you also enter the national births by sex. This is required for all countries because it affects the reports generated. You enter the year, the number of male births, the number of female births, and then the total number of live births. Then you want to enter the births by census division. So you want to, this is optional. You enter the census division, the male births, the female births, and the live births. We have national mortality by age group and sex. This is required. All countries should have this data. You have the number of male deaths, female deaths, and total deaths in different age groups and in different reporting years. But the death is regardless of the cause of death. So you enter the total death in the country regardless of the cause. I think you get that data from whichever department or ministry is concerned with keeping that record. Now, when you enter these dependent surveillance variables, make sure that when you're entering past records, the census population or those reporting variables closest with the year closest to the years of past record is on the system. If not, the calculation of those things like deaths per 100,000 population, let's say you don't have the death record for 2013, but you have the patient record of 2013, it is not going to calculate that figure because it is not finding any census population that is less than the reporting year, or equal to the reporting year, but it always is seeing population higher than the reporting year you have selected. I don't know if I'm making sense. Somebody should let me know if it's understandable.
Could you go over that, please, Mildred?
You said? Okay, so okay. So when you enter this census population or any of the surveillance reporting or dependent variable, which starts from the census population, you must enter those census population or those variables for the reporting year or less than the reporting year of the earliest health record you are entering on the system. So for those entering past records, you have to make sure that if my past record is a 1998 past record, I want to come here and make sure I have a census population that is equal to 1998 or less than 1998. The system's command for auto-generation of reports is that it will use the census year equal to the selected reporting year or less than but closest to the selected reporting year. It will not use the census population above the reporting year. So if you select 1998 and your census population data on the system is 2020, it will not use that. That is going to be an error, right? It won't use that. It will leave the calculation blank.
So Mildred, It means then that we can put in more census data than just for 1 year. We can put in multiple years. Okay.
Yes, you can start from 1960 down to the most recent.
Okay.
Yeah. But just want to make sure that as much of the past records you are putting into the system, you want to have census population that either predates or is equal to the health record. So we have the exports. You notice that you can use this to, the pages are paginated and you can search, but you cannot export from these pages. To export all of this data you've entered, maybe you want to have a record in the file, you click on export sites. It will give you a table of all the sites you entered into the system to export to CSV, Excel, PDF, or to print out. It will also give you an export option for all of the ethnicities that you have on the system. It will give you an export of all of the health districts and then all of the parishes and all of the pharmacies. Then all of the drug and treatment regimen, you want to print it out to verify or to give someone. You want to see that these are all of the drug and treatment regimen you have on the system. So it's easier to print from here or to view properly to have in a file. And then you want to also export the vaccine list. So you have all the lists, 10 per page until you get to the last vaccine that is recorded. So if you need to verify with the vaccination or immunization manager in the country, you can print this out and give to them to verify if these are the correct list of vaccination given from birth to adulthood in the country. You can print this out if you log on to with the email and password I gave yesterday. You can print this out to verify. So when you configure your live systems, you have the correct list that is used in your country. You can also enter a list of vaccines that is not used in your country in case you have a transfer in and you want to put in the record of their vaccination records that they have had in the past outside of your environment. Then you can print out also the screening list. Now, I'll advise everybody to print this out or export to CSV so that you can upload to your system. I got this from the lab, and it's an exhaustive list of all possible screenings. So you will not have to look for it. You can verify also with your lab if they have everything here, if it has a different name, or if there is something that you don't do within country. So you have the list of all screenings available. Then you also have the vaccine schedule. If you entered this in the system, you want to print out to send to an office for verification if this is the correct vaccine names, the age range, and the series or the dose of the vaccine at each point. Then you can also export the roles and permission for administrators to know what permissions to grant to users when you create the account and the role. And this is the start of today's agenda. You want to know the permissions that all the roles have. You want to know what role holds what permission. You want to know what the users can access on the system when they have certain permissions. The administration role, which we are on now, has 4 permissions. When you give the users account permission, when you create their accounts, they will be able to create users and manage users. They'll be able to assign users to a pharmacy and to a testing site. They'll be able to update account information of clients, search missing unique IDs and all that. If you give an administrator a system configuration permission, they'll be able to do all of the functionalities on that system configuration that we have discussed. If you give an administration role supervised screenings permission, they'll be able to see the screenings in every site and the records entered into the system by every site, by each site, so they can group screenings by site. If you give history tracking permission to an administrator, they can look at the client screening history. They can look at the client's address change history. They can look at the client's pregnancy history. Any questions before I go forward? Okay. So if you now give the role of monitoring and reporting to a user, monitoring and reporting roles are designed for surveillance officers. Screenings report is going to give them auto-generated screenings, reports, and screenings figures. It will give the positivity rates and every report on the reporting indicators list that involves screenings and results. It will also give the behavioral reports of the client screen and behavioral reports of the clients that are positive. It will also give you positivity rates by test modalities, by testing sites, and on a national level. Cases reports is going to give you reports on HIV care management, TB care management, and other STI care management. ANC report is going to give you reports on all antenatal and PMTCT activities. Pharmacy reports will give pharmacy-related reports, reports about stockouts, reports about people on PrEP, on PEP, and reports about drug pickup versus prescription goods. TB reports will give you TB-specific reports for clients that have active TB, or for clients with TB in general, or HIV-TB infection. Then for screenings and management role, this is the role where all the testers, the hospitals, the clinical care team, the pharmacies, the central medical stores, the MTCT coordinator, the clinical care nurses, the psychosocial or social workers, and psychologists belong to the screenings and management role. If you give general population screenings permission to somebody with this role, that person is going to be able to create client accounts. The person is going to be able to collect all the information for both personal and screening information for a client. We'll be able to register pregnancies. We'll be able to record antenatal sessions. We'll be able to record delivery and births. We'll be able to refer clients for care management, positive clients for care and management. If you give a user whose role is screenings and management a referrals permission, they can refer clients into care. That will be the only functionality that they have. If you give updates, they can only update information when they have a unique ID without having access to the client record, just the result. If you give a care registration permission to a screenings and management user, they will be able to register clients into care and record initial and clinical evaluation of a client. If you give the Psychosocial Adherence Counselor permission to a screenings and management user, that person is going to be able to record all of the adherence counseling session, all of the pre-treatment counseling section, all of the strategy work plans, and anything that goes on with the social work for the clients. If you give a screenings and management user a routine permission, they'll be able to schedule routine appointments for clients and be able to monitor clients' screening and clients' appointments. So they'll see when a client they'll get flags of when a client misses an appointment, when a client misses a screening or important screening, and all those types of important deadlines. If you give that user a clinical management appointment, then the user will be able to look at the care card and the treatment card of all the clients, both for HIV, for TB, and for other STIs. If you give a central medical unit permission, they'll be able to enter drug stock, drug distribution to pharmacies, stock out, and they'll also be able to record drug recalls. Pharmacies, if you give them the pharmacy permission, they'll be able to enter stock received from the central medical unit. They'll be able to see alerts for stock running low, stock out quantity remaining. They'll be able to record dispense. They'll also be able to look at the treatment card of a client. If you give a prevention and control permission, contact tracing PMTCT, counseling session for pre-test, post-test comes under prevention and control. Risk reduction plan, prevention and control. Screening of listed contact or partner notification, prevention and control. So these are the permissions of the system. Again, the system uses role-based access. Authentication is done based on the roles. Authorization is done based on the permissions. When a user is assigned a role, the user is going to be authenticated into the home page of the assigned role. The system then checks the permission assigned to that user and then releases the drop-down menu of the file of the submenus that hold the permission assigned, or that are controlled by the permission assigned. So a user will not see the whole functionality of the system except to give that user all the permissions of the system or all the permissions of the assigned role. No user can have two roles at a time with the same identity. So if a user has to be an admin and has to be screenings and management, they have to use two different accounts to access the two different roles. Any question before I go on?
Mildred, yeah, that particular permission concept may tend to be a challenge here because we have one person that would have multiple roles. And correct me if I'm not understanding this right. You're saying that the permission names, which is, for instance, referrals, updates, and the list that's on your screen. You're saying that if somebody registers with an email address for referrals, they'd have to have a different email address to get the updates. Am I interpreting that right?
No.
Okay.
So now you can give multiple permissions, but you can't give multiple roles.
Roles, okay.
Yeah. So if you give a screening and management role to a person, you will get the list of the permissions for that role. Depending on the permissions you give that person, the person is going to see. So you can give multiple permissions, and I'll show you that now. I want to create a new user, right? And somebody on the call that has not received an email should give me their name.
That has not received an email. What email?
Account activation email this morning. I sent out accounts for some few people this morning, not everyone. Janelle, I can see you've activated your account.
Yes, I did.
Yes. So who else is on the call who has no account yet? Just give me your name.
You have not what?
Who did not receive an activation email this morning? So let's
I didn't.
I'm checking my junk first just to be sure I didn't receive one, right?
Yes, so these are the people who received emails this morning. So we have, okay, so we only have Desta from Dominica. We have Lisa from St. Vincent. Janelle received, Delcora received, Dr. Nisbet received. So these are the only people who received. So we can create accounts for the others on the call who did not receive.
All right, so Deroy, D-E-R-O-Y.
Okay. Last name?
Ferdinand. Yeah, Ferdinand. Ferdinand. Yeah.
Okay. Email address?
DE Ferdinand at gmail.com.
Okay. And so let's say we are giving you what's like your job role? Screenings?
No, usually in administration.
So we'll give you an administration role. So now automatically we get the list of permissions under this role. So if you are creating accounts, we'll give you users and accounts. If you are doing more than account creation and the system configuration, we'll give you this. But then you are not going to supervise screenings and you're not doing history tracking.
Okay,
and so you have these two permissions, and I'll click on create. So you should get an email now to set your password and activate your account. Okay?
Yeah, I got it.
Okay. So when you set your email, when you set your password and activate your account, you will see only configuration and users on account. You won't find supervision and history on your menu.
Yeah.
So you got that?
Yeah.
Okay. So for Nilan, I'll give you system configuration permission.
Good morning.
So for those who have activated and you have users and accounts permission, try to log in and create a user that has not been created within your country. You can see the list of the users whose accounts have been created by clicking on View All Users. And then you see the users whose account has been created. And you see the names and the email address. And then if your accounts or the person in your country's account has not been created, you can create their account and assign them to their proper roles and permissions. Janelle, you can create accounts for the participants in your country. For people who are IT staff, you want to give them the administration role. And within the administration role, you want to limit the permission to system configuration. You don't want to give users and accounts permission to anybody outside of the health team. And the reason, even if they're in the Ministry of Health, except if you have the permission to allow them access to patient record. Because once they can create accounts, they can do and undo, they can download patient record, they can view patient records. So you might want to limit IT or any person outside of people who are authorized to view client record to system configuration. All of the program managers can have all of the 4 permissions of the administration role. Program managers who do testing will have to have another account and have a screenings and management role. And then you will give yourself either you want to give all the permissions or read about the definition of each of the permission on the left side of the screen and what the permission does. So you assign permission based on what is written here, and then you know which users belong to those permissions. You want to give permissions to NGOs and external or private labs to do general population screenings and to do referrals and to do updates. For external places, NGOs and private labs, you want to give general population screenings, referral updates, and also for NGOs, you want to add psychosocial or adherence counseling in case if they do those kind of support or level of support for clients. Is it clear? Should I repeat?
The psychosocial adherence one, Mildred, how is it different to the prevention and control? Because for an NGO in particular that does the testing, the level of counseling from, well, in the Grenada context is really post and pre-counseling sessions that they do. So how is the psychosocial adherence aspect different to the prevention and control? And in that particular, I'm referring to the counseling aspect in the prevention and control.
Okay. The prevention and control only does counseling that has to do with the behavioral risks of the clients. We only record things that has to do with their behavior. So somebody is not HIV positive, has 5 to 9 sexual partners, is a high risk client, and you start the risk reduction plan with the number of condoms or bringing in partners for testing, either sexual partners or injection drug partners. That is the kind of data that the prevention and control collects. Psychosocial adherence collects information mostly for clients in care, because you want to do the adherence readiness assessment for people who are positive and needs to be placed on ART. If the people are not ready, there is an adherence strategy work plan that is used to access or to test their level of readiness. And there is a pretreatment or a medication adherence for those who are already on medication to test their level of adherence. So that will not actually go to people who do not see clients who are positive and are in care. So prevention and control will be what you want to give to the NGOs, because they will record those condoms distributed, pamphlets, risk reduction sessions, pre-test and post-test counseling, contact tracing, listing and contact tracing, and partner notification services. Is that clear?
Yes, very clear.
Okay. So I will go away for 15 minutes and let you guys create accounts for your participants. Again, I will leave on the screen the list of accounts already created by me so that you don't waste your time trying to do it all over again. For Nevis, we have Dr. Nisbet and Nadine, right? For Antigua, we have Delcora, and we have somebody else, Karen. For St. Vincent, we have Deroy, Nilon, and Lisa. And for Grenada, we have Janelle. So the rest has no account on this system yet. You want to create the account, assign their roles and permissions. Once you do it hands-on, we can review if they are in their correct roles and in their correct permissions. So I will stop talking for the next 15 minutes. It's 9:55, and I will start talking at 10 minutes past 10. So that is. Okay, so now we have had some hands-on practice on how to create accounts, assign the roles and permissions. Does anybody have any questions or observations or any confusion? So after today's session, you can log on with your account and continue creating accounts for every participant of your country for the rest of the training workshop. Whatever you do on this site is exactly what you will do on your training and live site. I will update those sites by the end of next week because it's going to be confusing to use this new version on your live and training site until we get to the point where we will get to by Friday next week, and then you can resume use of your live site. So you can use this system, this site, keep practicing and keep changing things around. The next thing we want to look at now is after you create users, there is something you must do for all the users before they can use the accounts. For users that are pharmacists, you have to click on register a pharmacist. You have to select or enter in the email address of the user. Let's say, enter your email address, and I'm going to, sorry. So before you can do this person must have the pharmacy permission. So I'll have to use a user who has the pharmacy permission granted. Let's see. Now, this user has the pharmacy permission. And because there is a pharmacy permission, it gives me the form to select the name of the pharmacy that this user is going to be associated with. So that during dispense, entering of stock, when this user logs in, stocks will be deducted during dispense from the pharmacy that is assigned to this user. If the user is going to be dispensing or working from a different pharmacy, you have to change their pharmacy assignment. If not, the stock is going to be recorded against the pharmacy assigned. So I can change this registration for this user. And by the time the full page refreshes, the pharmacy name has changed. So every time you need to reassign an assigned pharmacist, you put in the email address, you change the pharmacy, and it updates. For the rest of the users, you have to attach them to their testing and management site. Every time they change sites, you have to change their links or the site they are linked to. Because now we want to start having site level and national level reporting. Nobody who is assigned to a site will find records or find reports of clients that are not screened at their site or that are not clients that come to their site. So we'll look at all of the people whose accounts we have created and want to look at the names of sites. Now, this is where the site name comes in. If the name does not populate on this list, it then means that you have to go back to configuration and put in the name of the site. So now again, before you continue to linking users to sites, you have to go to configuration, testing and management sites, and enter the names of the site of the participants before you can link their created accounts to the sites that they run or the site that they work with. Okay, Janelle?
Mildred, I have a suggestion for in the case of the pharmacist, right?
Yeah.
In our context, pharmacists tend to change very frequently. Is there a possibility whereby where you can allow the pharmacists, let's suppose they are, because I believe that we're not only, this is also for vaccines and so forth, right? The site is for not just HIV. Allow the pharmacists to change their site when they log in so that it can populate for that particular site. Or when we sign them up, we give them access to multiple sites. Instead of every time the developer would have to reach out to the pharmacist, because let's suppose they move to a site now and they're trying to get the developer, the person to change it, and we're not available. From my context, I think that's a permission that they can have whereby they can change their own site, or we allow them multiple site entries under their account.
While that is possible, that is going to be a big problem. And the problem is this: when it comes to somebody might forget record stock is deducting from another pharmacy. So whatever you get the system flagging will no longer be accurate. Because if I dispense a lot today and I forgot to change my site, then I'll be dispensing against another pharmacy and their stock. Another thing again that can happen is accountability. So if there is a fraudulent activity going on, you won't be able to control it. So what you can do is that you can give that permission to the pharmacy managers. So if somebody new comes to their pharmacy, they have the ability to change, to switch the person who comes into their pharmacy. If the person leaves, they can switch it. So it's something that you can give that permission or that account to whoever is the supervisor at the pharmacy.
Okay, I understand.
Yeah. So that person is going to have the permission for users and accounts to be able to add pharmacy permission to anybody who just comes into their pharmacy and to be able to register the person. Then that way you can have better control, because if anything changes, you know who is responsible, just the supervisors. Sorry, I can't hear you. Oh, thought somebody was talking. Okay, all right. Okay, so now you have to update the list of testing and management sites for you to be able to associate your created users to a site. And we're going to see all of this, the effect of this, when we start creating client accounts and we'll start looking at the reports. And it's something that was not present before. Before now, the surveillance officers will get all the reports, or the program managers will get all the reports for the country. They can get the screenings by site, but the sites, the NGOs cannot see reports for what they did at their site. But now, that entering of sites during screening, you don't enter your site. The system marks the screening against your associated site. And so your reports will be generated on your page as site level reporting. We'll see all of that next week. And now we have to update the testing and management site and associate all the created users to their site. I will leave that exercise for you to do once we finish this meeting. The site will be available. You keep creating users, checking all the users you've created, send messages for them to activate their accounts, look through the permissions. The other functionalities of this are functionalities you can't see accurately now until we begin to enter client record. The other functionalities are to view all users. You can see this now. You can see all the accounts created and the activation status. So you can always log in back to see if your participants have gotten their emails and if they've activated their accounts. Then you can also come here to look at missing unique ID. Now we don't have any client record on the system, so you can't find it. So if a testing site calls to say that a client has been screened or registered on the system, but they can't remember their unique ID or do not have the ID card they used previously. If at the time of screening, the client's name was entered on the system, the supervisor is the only one with the permission to search for unique IDs by first name and last name. You can search for exposed infants by entering the last name of the exposed infant, and you can also search an antenatal client's unique ID by entering the first name of the antenatal client. So this permission is just for supervisors to retrieve IDs so that you don't have multiple accounts for one person. But it only works if you had actually entered names of people when you collected the personal information. Then you can also update personal information. There are information of clients that can never change, no matter how they try to change it, except if they told you a lie the first time. The date of birth will never change. The country of birth can never change. Those security changes, those kind of things that can never change, once entered once by the tester, they cannot update it. Only the supervisors can update. So at the time where they come to tell you that somebody's date of birth changed, you want to find out how that is possible. Was it a typo in entry? Then only the supervisor can change those information. So you can change a client's date of birth, you can change a client. Even the names of the clients cannot be changed by anybody but a supervisor. The date of birth, the name, the unique ID used to access the file, and the testing code of the clients. The ethnicity of the clients can never change, and the country of birth can never change. These things are the fields that only supervisors can update. So when there is an error in entry by a site, they will have to call whoever the supervisor is with the unique ID to make that update. Then we have another functionality here that allows for updates of personal information for antenatal clients. And it's the same process like the other population of clients. And this concludes all of the functionalities under users and accounts. Again, you have to go back to configuration, make sure the sites in your countries are there, go back to ethnicity, health district, parishes, and pharmacy, enter the names of these sites and pharmacy and parishes and health districts and ethnicity in your country, look through the drug and treatment regimen. If you have anything that is not here, that is wrong here, or that is different, add to the list. And then you also go through the vaccination schedule. If you have them in your head, if you know how to put them in, you can put a schedule, anyone you know about here for the system. And then you can also have input, create the users and associate the users now to testing site and the pharmacist to the pharmacy. And what exercise we are doing now are the exercises we are supposed to do tomorrow. So I can be here tomorrow again to repeat all of what we have done so far, since we will not spend so much time creating accounts. If you maybe just take 30 minutes after this to create the accounts for your participants. Early tomorrow, I'm going to look through the list with my own master list and see if there's anybody who is registered to be at the training whose account is not created. I'll either let you know or I'll create them. So our agenda for tomorrow would have been to create these accounts that we are doing now, and also to repeat this account creation, permissions and roles. You will see on your page on your resources that I have a file named roles and permissions that you can download to look at the different roles and the permissions that they hold. On the create a new user form, on the left side, you have the description of the permissions under each of the roles. So that can guide you in creating. You can go to view all users to see all of the users that you have created and see if they are in their correct roles of permission. So every user at an antenatal center in the maternity unit is going to have general population screenings permission. Remember that before now we had the antenatal and postpartum, which we do not have anymore. Everybody is under general population screenings now. And then the system classifies or generates reports based on the behaviors and no longer based on labels. So the risk behavior. So somebody might not be homosexual, but is romantically attracted to a male to male. So we are recording or collecting this information as risk behaviors and not as an MSM. He's a male that has sex with male, quite all right, but he's not a homosexual because he's attracted to both male and female, and he doesn't identify as a bisexual. So we call it a risk behavior, MSM, a risk behavior of transsexual, a risk behavior of injection drug user, and those type of stuff. So if you have questions, I can stay to answer. Or if we don't have questions, we are finished with all of the agendas for today. So is everybody okay?
Yes, from here.
Okay.
Yes, Antigua.
All right. Okay, so this is where we end for the day. We will see tomorrow where we are going to review everything we did this week, and we're going to look at difficulties and suggestions, and then we will get ready for client screening and recording of clients starting on Monday. Have a very good day, and thank you all.
Thank you and bye.
Bye-bye.
Bye.
Yeah, bye-bye.
Yeah.